All right, so for those of you guys that are listening still that cannot see the video, we're switching to me going over a couple different types of workouts. Now, excuse the pups in the background. They're enjoying life right now. Now, as I go through this, I'm not going to complete each exercise till failure or time under tension, just due to me getting through a lot of these different types of exercises and different types of ways that you can think about exercising, whether it's adding some of these in to your workout, whether it's creating a workout just using these, or using some of these into your warm-ups. There's a bunch of different variations. Now, a couple principles we want you to know. We're going to be targeting joints different than ligaments and tendons, different than muscles. And that's broken up into pretty much 3 different areas. With the joints, it's going to be moving the fullest range of motion a joint possibly can, but just focusing on one joint at a time. So that's going to involve stabilizing all the other local areas above and below where that joint is. Next, we're then going to focus on for ligaments and tendons, and this is mixing in through some of these exercises and workouts, which I'll describe as I go through each one on the reason how and why. Now, for ligaments, tendons, those are usually isometric contractions when the tissues / muscles are lengthened. So if those that you're listening, if your arm is completely straight and you squeeze your whole arm, most people are going to notice more tension where the joint is or at the end of muscle bellies. So this would be focusing on full length and at length isometric muscle contractions. You can do something similar, but it would be shortening. So bending your elbow, and then it's going to then force and squeeze all the muscles in your arm. You're going to feel that more in the muscle belly. So there's a difference between squeezing your muscles, tissues, at length, depending on what joint you're focusing on. So, bud. And that's will give you a good idea in terms of what we're targeting. And then for the muscles, that's going to involve concentric, eccentric work, or shortening of the joint and lengthening of the joint, or holding a specific angle and moving for continuous movement in a plane or an area or in space. So we're going to mix in all those different aspects into the training so we can be very specific on what tissue we want to target. Now, to train the system and to train your body, you can go for a large number of reps and sets. Usually that comes, if you're pushing yourself with resistance, that comes in form of hypertrophy. You can move in a dynamic fashion at speed or quicker versus slower, focusing more on power. You can focus on lengthening or slow molding tissues, which involves stretching with isometric contractions, or contracting certain muscles as you go through the fullest mobility or fullest range of motion possible. Now, when you first start off with some of these areas that oftentimes get neglected, you have to be cautious about how much intensity you put towards some of these efforts and some of these exercises. Be cautious because you're probably going to feel soreness afterwards, maybe a few days afterwards, which usually is due to delayed onset muscle soreness. It's almost like if you haven't worked out or haven't worked out a specific muscle or tissue in a long time or ever, the body's not going to understand for the small muscles what that pressure and what that damage is to some of those muscles. And it's going to send that signal of achy, dull, sore, tension oftentimes, or it's going to lead to tightness. But if you have certain areas of tightness or you feel like something is either popping, grinding continuously, you have to back off on that increased range of motion or be cautious of even doing that exercise itself, unless followed by a trained practitioner that specializes in movement biomechanics that can diagnose and then also help treat. So we're having a general understanding with that. We can either go work effort to failure, to where you can't move anymore. And more or less, that's going to send the signal from the brain to tissues to be like, okay, we need to not only heal the tissues, but lay down and send signals of hormones, chemicals to the area to rebuild and strengthen that area. Or we can go till we feel a good muscle burn and maybe do a couple sets of it at that pace or that amount of load. Or we can go until we feel nice mobility, working some of the tissues, but not pushing the system too much. And all these can be added in different times of the day, throughout the day. I would suggest to try, if you want to accelerate the results, you have to maximize not only sleep, also recovery. So you can start thinking about, if you want to do 2-a-days, doing the same workout, monitoring the intensity, of course, in the morning or at lunch, and then doing either another set or a couple sets of those same exercises at night. So you're doubling up, you're breaking down the tissues, the body's healing, recovering as you go through the day, and then you hit those tissues again, which also sends another signal to the brain of, okay, we gotta lay down tissue, we gotta open up this joint space, so it can accelerate the results. But then if you're gonna do 2-a-days, you have to make sure you have a really good night's sleep, and then that following day, or probably potentially for some of you, a few days afterwards, wait before you target those either same exercises or same tissues in which you worked, especially when starting 2-a-day process from there. So let's start off with these 2 types of workouts. So the first workout, we're going to be focusing on neck, upper back torso rotation, shoulders, and wrist extensors. Now, these are oftentimes neglected, and I'm going to go through targeting joints, generating intensities, so we get the nervous system on board, so we get the joints, which oftentimes are not trained at all, and then we can start laying down tissue in different planes of motion. So you have to pay attention to muscle insertion, origin, or where muscles attach to, if you're a practitioner and want to add some of this in and have a general understanding why. But then also, if you don't have that background, you can see why and how we're doing it. So you can add this into your own workout routine yourself. Now, the next workout we're going to get into after I follow up with this upper body, neck, arms, wrist workout is going to be legs. It's going to be specifically thigh tissues, a little bit of focus on the feet, and lower back mobility, movement, and strengthening. So that'll be exciting. So stay tuned. If you need to, they are timestamps below. You can fast forward and go from there. When you first start working out, you want to generate energy so you can create effort and actually go through your workout with less risk of injury. Now, usually on how that starts, especially how the nervous system signals to the tissues and the body, and vice versa, body tissues back to the brain. You want to increase that connection, so that's going to involve joint-specific full range of motion movements, and it's also going to involve generating the intensity of your nervous system as well. So what I like starting off with is intensities. Now you can vary the intensities, 100% your max muscle contraction, the max you can squeeze any tissues throughout the body, versus 75% your max squeeze, or 50% or 25%. So starting off, when you first squeeze all the muscles in your body, I want you first start off slower, pay attention, have that mind-body connection, and then ramp up to 100% squeezing all the muscles in your body. Now, if this hurts a little bit, or if you have any old injuries or any areas that are sensitive from past injuries, pay attention to those mind-body connection. Can you generate that contraction up to 100%, or do you have to vary that down? And that can give you a general understanding how hard to push that specific area and what range of motion that you probably want to limit going into, especially for longer periods of time. So we'll start off by generating the intensities. You can do this seated, standing. Ideally, standing works best. Doesn't matter as much in terms of position posture, but we first want to focus on either squeezing the ground, closing our fists, and just start squeezing all the muscles in your body from your feet to your hands, to your spine, to your core, to your jaw, and then ramping up to 100% for a few seconds, and you can go more, and then slowly backing off on the intensity, ramping up again, slowly backing off, doing that a good 2 to 3 times. Maybe find a different position, seated in a plank position, and then again, trying to squeeze all the tissues from your fingers, hands, toes, quads, core, back, neck, jaw. That will help get the nervous system on board. And then as you squeeze, you can also add this in. Just start focusing, squeezing all the muscles in your body, but start focusing on one area. So for me, I'm focusing on my left shoulder. And then try to get a good understanding. Can you squeeze the muscles in the back of your left shoulder, the front of your left shoulder as you're keeping everything contracted? And you can go through in different body parts and squeezing and try to focus on the specific area. That will increase proprioception. It will increase how your body connects to your brain and vice versa, which then helps not only performance, recovery, rehab, a lot of different areas. So I like adding that into your workout starting off with. Now let's go into joint specific movement. And if you know how the nervous system signals to the body and body to the brain in terms of tissues connection, if there's any problem with any joint, it's going to cause overlying muscle guarding tightness. So paying attention to compensations is going to be a whole thing in itself. But in terms of joint specific movement, we need to move each joint through the fullest range of motion possible, clockwise, counterclockwise. Usually you want to go through a good 3 to 4 reps each direction, but in terms of now, we'll go through 1 each joint and we'll move on from there. So these are also known as CARs, or controlled articular rotations, or workspaces. How much can you move that joint in the biggest range of motion? So what workspace can you find yourself or that joint moving in, okay? If we're gonna focus on moving and doing an upper body workout, okay, what joints are needed? The joints of the neck, the torso, the shoulder blade or the scapulothoracic joint, the glenohumeral joint, usually working in with the AC joint, so your shoulder. We're going to need the elbow joint if we're going to flex or strain our arm, and then all the joints of the wrists. And if you want to take that step further, you can go into fingers and those joints as well. But I'll tackle that when we go into wrist extensors, because that'll work as the whole upper body arm just the same as well. So let's first start off with the neck. For this one, if you haven't followed, we're going to go tucking the chin down to your chest, sweeping your chin to the side, starting to rotate, tilt back around. You should feel a stretch in the opposite side in which you rotate. If there's sharp pain on the closing angle side, diminish the angle in which you rotate and then continue on, go from there. Now, you can also do, if you feel sharp pain on one side, you can go back the complete opposite direction. Right before where you feel that sharp pain, diminish the angle and continue from there. We don't want to move into the sharp pain. Again, both directions, counterclockwise, fullest range of motion possible. Clockwise, counterclockwise, okay? Now we can focus on either full spine, but for this case, thoracic spine especially. For most people, crossing their arms or touching the opposite side shoulders, stabilizing the neck, and the focus is moving the torso, mid-back, thoracic spine, and rib cage, okay? So you can do this by taking a breath in, holding, so we expand the ribs and intercostal space. Start by flexing just a little bit forward, twisting first, then extending when you can't twist anymore. Extend back, twist back over till you can't tilt anymore, and then you rotate back to center, okay? Again, we're gonna go opposite direction. Breath in, hold, flex, rotate as much as you can. Start to tilt, extend, come across opposite way, and then rotate back to center, okay? That is thoracic spine mixing in with rib cage. What else do we need? We need scapulothoracic joints. We can either do this with the arms in front of us, contracting all the muscles in the arm, so everything's straight, squeezing all the muscles and stabilizing the rib cage, torso, and neck. And then we're going to start off by reaching forward, shrug, rotate back from into depression, and then reach forward and up from there. Opposite way, from reaching, depress, retract backwards, shrug up, reach forward, and relax there, okay? There's another way if you want to do it with your arm on your side. This will be more for AC joint or anterior capsule work, but there's a bunch of different ways you can go about this. Arm by your side, thumb facing straight forward, palm to your side, keeping all the muscles in your arm straight, contracted. Same thing with your torso. We're going to bring our shoulder down, depressing down, rolling forward till you can't anymore. Shrug up to the ear, rotate backwards as far back as you can without twisting the thoracic spine to rib cage. Depress down, and then back to neutral. Same thing, opposite direction, and back down, okay? That is the scapulothoracic joint. Now let's get the glenohumeral joint, AC. So again, arm completely contracted, same thing. Torso, bringing our arm across our body, all the way to arm to ear, rotate towards the ear as you're pushing back and away to where you want your thumb to end extended, or your thumb facing away from your body, and then come back to center. When you start backwards, you first want to start with your thumb straight back so you can't anymore, and then start to open up, untwisting, so your palm then goes to your body and then rotates in front of you, palm facing forward, and then back to your side, okay? Both directions, okay? The more you get to that angle of tightness where you can't move anymore, that would be more level 2. You can add in weight level 3. So if people want to work on joint-specific effort, I'll show you a couple things here in a sec with weight, or whether it's dumbbells, kettlebells, bands, rather, either or. Now, let's go into elbows. Again, fullest range of motion possible. Arm to your side, palm opened. We're going to start by rotating the palm outwards as you flex your bicep. Once you can't bend anymore, we're going to rotate your palm facing outwards, straightening your arm, and then both clockwise, counterclockwise, go the opposite direction, okay? Then we're going to tackle the wrist. So with the wrist, if you need to grab your other arm below, underneath, and attach to the outside bone of your forearm of the opposite arm, that can help from rolling the wrist that you're focusing on, okay? Doesn't matter how you start, where you start. So we'll start extending your arm backwards, starting to rotate off to the side, flexing the wrist to your forearm, swiping inwards closer to your body and extending, okay? And then the opposite direction, same type of movement. It works really well if you open up your palms versus fingers together, because then it gets more of the intrinsic muscles of the wrist and hand as well. You can do the same thing, thumb, clockwise, counterclockwise, and then fingers, flexion, extension, or try to extend all of your fingers, all of your wrists as far back and out as you can. Now this is where the wrist extension comes in. If you extend, open up your fingers, extend your wrists, start waving off to your side as you bring your arms backwards and forward. This can help shoulder, upper arm, neck, which often get neglected for wrist extensors. So that's a good one to add in between working sets of large grip work or heavy weight that you have to lift usually from the ground, or pull-ups, any type of overhead pulling movements that also help quite well. That is joint specific work. That is how you can add that in. Now those training the joints, that can be added in between each lift, especially if you're generating a lot of intensities. So it's almost like an upload of whatever effort you just did of those specific joints or that specific exercise, that if you add in joints afterwards, that information can get put back up to the brain, which can not only, one, help generate the intensity and effort easier, but it increases your range of motion as you're strengthening your body. So kill two birds with one stone, might as well. Next, we're gonna add in rotational work with the joints and the workspaces. Well, we can start off by especially thoracic spine and shoulders, okay? So we can either do this by grabbing a band and work on twisting movements. So we have a band here. You can attach it to an object, have your arms closer to your side, just generating twisting movements of your spine as your hips are facing forward, head is facing forward, twisting off to the side and back to center. If you want to really go more for the rotational work, have your body face complete 180 from the insertion of how the band is held, and then start to twist off to whatever direction that band is pulling you towards, which you can get a little bit more range of motion that way. Or if you just want to stand perpendicular, that works just as fine. The more challenging portion, if you have the band farther away, it just creates more of a fulcrum. So then you can either go band back to center, or you can twist as far over as you possibly can. Now, if you vary the angle upwards, you can either come across your body, or you can come back and down. And this is where you can vary different areas of rehab for shoulder conditions based on adding in front joint capsule of the shoulder to back joint capsule of the shoulder. Perfect for golfers, anyone that swings objects, desk workers, pretty much everyone for that matter, okay? So that is rotational work of the torso rib cage. Like I said, there's a bunch of different ways you can go about it, but we're focusing on not only twisting movements, because mainly the joints in the thoracic spine are laid down for twisting movements primarily. So not only do we want to move the joints in that direction, but we're laying down rotational effort of oftentimes the core abdominal tissues from the front all the way around to the lower back. And then also engaging the arms, stabilizing, but the effort and movement is through the rib cage, thoracic spine. Now to warm up the shoulders, let's go and move those into extension, flexion with rotation. Now, because the joint is the first line of communication to the brain, rotational work is also incredibly needed. So for example, for those that are not watching, I'm extending my arm backwards, so my humerus or upper arm bone is going forward. So that is bleeding a lot of effort into the front anterior capsule of the labrum and a bunch of different tissues of the bicep head, of the pectoralis tissues, even some of the muscles in the front of the neck. So as we go through, arm goes backwards, you start rotational work and you go time under tension as long as you possibly can, or bring your arm backwards, squeezing all the muscles in your arm, or if you want to put an object behind you, wall, and then trying to put pressure of your hand holding onto the object down into the ground or forward will help bleed the energy to the front of the capsule, which will then help subsequently for the tendons, especially as the tissues are lengthened. So if you have any problems with your bicep, head, tendons, lengthen, contract, but pay attention to if you have injuries, there's a bicipital groove that the tendon come in and out of, so be cautious that there's not as much snapping when you go into rotation, or if you hold that position, that if you put pressure that it's not painful. You might have to move your arm inwards or outwards, so just something to pay attention to there. Okay, so now as we warmed up the tissues, we generated the intensity of the nervous system through intensities, workspaces / cars. Now we're going to start laying down tissue, okay? Now pretty much we're training and rehabbing from internal communication and deeper structures to the more superficial tissues overlying, okay? Now we'll start off with the neck, then we'll get into the arms, shoulders, and a little bit of the torso. So to address some of the tissues on the neck, we want to first start off by the deep tissue. Hi bud, excuse me. We want to start off by some of the deep tissues on the front of the neck, especially the longus colli, which connects to the front part of the spine. So we're talking deep tissues. Now, oftentimes, if you have headache, especially tension headaches at the base of the skull, there's different studies that we brought up in previous episodes that if you tuck your chin to your chest, lifting your head up off the ground table and holding that there as long as possible, that's going to help increase the space between your C1 top bone in your neck and the base of the skull. Now, holding this as long as you possibly can, focusing on making sure that the chin doesn't jut upwards. If it does, relax and reset, because then it causes muscle contraction of the SCM, which is not really our necessary big focus target. Again, holding as long as you possibly can, the goal being a minute. You might start shaking, that's normal. You might cramp, that's okay. As long as there's no sharp pain, you're gonna be solid. Tucking the chin to the chest, lifting the head up off the table ground, holding as long as possible. You can add in rotational work as long as the chin is tucked, and then relax from there after you're done. All right, next let's start targeting some of the tissues on the back of the neck. Now there's a bunch of different tissues there which go from not only the jaw to the shoulder, but also the shoulder, mid-back, up to the neck as well. We're going to target the back area and laying down some of the tissues there. Now we can do this a couple different ways, either going to the edge of the bed, couch, and then focusing on jutting the chin back and then extend back to neutral and back to the ground. Retract chin to your neck, extend your head back and forth, okay? You can also just extend your head back multiple angles, so you're extending, tilting, making sure no sharp pain, of course, or extending and rotate, okay? You can add in weight from the back of the head hanging off the ground, but the huge focus for most people is not to move into sharp pain, especially if bones are stuck or fixated out of alignment position. That can cause a lot of nerve pinching, which can cause pain going down to your arms, numbness, tingling, weakness, and a bunch of other symptoms. If that is you, I'd suggest going to a chiropractor, physical therapist, where they can diagnose, treat those specific conditions. Okay, now let's add in the muscles on the outside portion of the neck. Now this is going to involve a couple different ways of going about it. Now with this, if you want to incorporate your upper arm with your neck, this is a really good way that you can go about it. Grabbing a dumbbell, kettlebell, or even band attached to the ground will work just fine. We can start off by tilting whatever side is holding the weight, or if just no weight at all, just tilting the head off to the side. You can depress your shoulder downwards and almost do a side ab crunch. From there, we're going to start by tilting the head and then shrugging that same side shoulder up and back, okay? You can also add in synchronized movements as well. So we tilt our head off to the side, depress our shoulder, and then everything tilts at the same time to the opposite direction, tilting opposite of your neck, and then shrugging of the shoulder, okay? If you want to isolate just the neck from the upper arm, stabilize the arm, tilting the neck off to the side, and then going back and forth, tilting one ear to shoulder to the opposite side, okay? A little bit more useful of your time, tilting your shoulder and shrugging, okay? I mean, you could do the opposite way, tilting into a shoulder shrug. That incorporates more of the upper traps. So usually we want a better glide, so this usually works better opposite side. Now, not only do we want to work in the frontal plane or side-to-side movements, but there's a whole 45 oblique range of motion that we can move into in front of us and behind us. So we can move into tilting our chin down in front, either to the opposite shoulder in which we're holding weight, or the focus of tilting towards, or extending your arm backwards. But if you do have their weight, I suggest bringing it 180 degrees opposite direction in front of you. Extend and rotate works better than extending and tilting. So that is a different way that you can lay down tissues on the outside of your neck. Let's go into the torso and neck itself, working into multiple planes in the sagittal plane. So working to chin flexion into mid-back thoracic spine extension, okay? Oftentimes, which is missed, is the thoracic spine has joints that are laid down like from superior to inferior, so from the sky down to the floor. Now those glide backwards, but enough to where you can allow better mobility and less tightness throughout your whole upper back, mid-back. So we're gonna involve the neck, rib cage, thoracic spine as we go through. So let's start off by tucking your chin down to your chest, flexing your whole rib cage spine down like an ab crunch, and then extending your head backwards, and then trying to depress your shoulders down. Now the huge focus for most of you, especially when you go into extension, is depressing your shoulders down. So it's just a little bit of motion. And yes, there's a large portion where I'm extending in my lower back, but the focus and where my body and mind connection is the bottom part of the rib cage to the top part of the rib cage. So if you need to hold your arms, shoulders, I suggest you eliminate and make sure your head is extended so you can get a little bit more motion. And the reason why we want to depress our shoulders and extend our head is it helps extension of the joints in the upper back, upper thoracic spine. You can add in rotation to the right, to the left, okay? Now that is huge because that is oftentimes people that have no idea, okay? So now we're gonna add in a rotational effort, full body, but it's gonna be primarily focused on core to extremity work with rotational of the thoracic spine and rib cage. So this is a perfect one for any dynamic effort movement. You're gonna need a decent amount of space. Unless you have a home gym, it's gonna be hard to do this at local gyms unless it's not busy and you have a lot of space to work in. Or if you have dumbbells, kettlebells that you can hold to your side, somewhat similar as well. We're just working on fulcrum, so the larger the object is outwards, especially barbell, the more pressure we're going to get, especially into eccentric or lengthening effort in the opposite way in which we twist, which can build the core torso tissues. So I'll show you a couple different ways. You want to start off, if you're going to do this, do it non-weight first and then build up from there, but I'll show you weighted so you have a general understanding. Okay, so as we go through putting the barbell lightweight, if you would rack it like a squat rack, okay? Now from here, we can incorporate feet. It can be sport-specific movement, but again, the focus is going to be on the torso, spine, rotational work from there. So we can start off by twisting, getting a dynamic staggered stance to where one foot is ahead of the other foot's back, not completely backwards, but stacked in the center of your body. From there, we're going to twist our body both directions. Take a step forward, rotate, step forward, and you can go forward and then backwards as well. Okay. If you want to open up your stride and then go into twisting movements of the body, you're going to start noticing as you twist from one side to the other, you're going to work on adductor tissues of your thighs, quads, especially transferring weight. If you want to get into different angles, you can add in tilting. Okay. If you want to add in muscles for swimming, you can tilt backwards into extension. Okay, just gives you a different understanding of how everything is combined and working together as a whole. So rotational work, both planes frontal, sagittal, and a little transverse. Now we're going to get into shoulders. All right, going back through laying down tissue of a muscle and tissue group that is often neglected is shoulder adduction, A-D-D, adduction. It's pretty much bring your arm to your side, and whether it's to your side in front of you or to your side and behind you. If you bring and put your arms out straight in front of you, palms facing forward, notice the angle of your elbow. Does it deviate outwards? If so, usually the tissues of not only the tricep, medial bicep can often become either weak or untrained, or you have lateral epicondylitis, a lot of tension from typing, desk work. This is something that is huge to add into your everyday workout routine or warm-ups or something thereof. So for starting off, especially for this type of tissue, I would want to start off intensities, palms facing forward, arms to my side, and squeezing all my muscles in the body, but the focus is going to be on trying to deviate our pinkies into our bodies, and then keeping our arms straight, our elbows to our side, or our wrists to our side. Either if your arms automatically go to your side, bring your wrist in front of you or behind you, works really well. So coming up to a wall, for here we have a little bit of the exercise area. The way your palm is faced matters, but for this case scenario, we want to lengthen all the tissues and try to bring your arm to your side as everything's lengthened. If you want to even go a step further, having your arm up overhead, holding onto a pull-up bar, and then trying to bring your arm to your side, like doing a side crunch at the same time in which you're generating effort, okay? If we want to add in repetitive movement and start laying down tissue, you can grab an exercise band, tie a knot, close a door, and then hold into resistance or attach it to a workout area itself. From here, palms facing forward, bring your arm to your side, holding that time under tension for as long as you can, or going down the band and having your arm come in front of your body while the whole arm straight, or behind the side of your body. Okay, front, back, just bring it off to the side, holding that time under tension as long as you can, or go for reps at a time, okay? That is one way that you can address the adductor tissues of your shoulder. Now start laying down tissue on the front and back side of the joint capsule of the glenohumeral joint specifically. We can go and do this a couple different ways. If we want to work on the front capsule, like we said previous, if you look at the upper arm humeral bone, when the arm goes backwards, if you were doing dips, that humeral head is going to the front portion of the capsule, which is having a pulling tension from front to back, A to P, either holding at the end of a dip, squeezing all the muscles the best you possibly can, focusing on the front of your shoulder specifically, not pec, and now bleed into the joint capsule, some of the tendons, ligaments. Now, let's say we want to work on the posterior capsule, or when the humeral head goes backwards, but your arm goes forward, usually palm facing up to the ceiling into a chin-up position, and trying to bring your arm to your side or pulling down your elbow down to your body, okay? If you're going to focus on that, even go slower down from a pull-up all the way down as far as you can, depressing the shoulders downwards and then squeezing all the muscles in your arms, torso. That will also help significantly from there. If you want to add in a little bit better joint-specific work, trying to bring your arm downwards or continuous effort down, your shoulders depressed downwards will help bleed into the posterior or backside portion of your joint capsule of your shoulder specifically. So you can go for continuous effort, longer periods of movement, of time under tension with your arm behind you, either against gravity or holding a weight or resistance against a band. So those are a few different ways that you can target and start thinking about how to address the tissues of your shoulder. Let's get into the next lower body workout. We'll show you a few things from there. Now we're going to get into the lower body workout, focusing on all the tissues around the thigh joint, a little bit of effort in the lower back. Also, through this, we're going to be involving specific muscles and stabilization of the feet, and also posterior chain, which will involve backwards walking, and then one special thing at the end that will show you as well. So, starting off with much the same with the upper body workout, we're going to start with effortful movement, bled into the joints first because that's the first line of communication to the brain and back down. So we're going to get into hip workspace, lower back workspace or lumbar, thoracic workspace, knees, ankles, feet, and you can go toes as well, but we'll start from there. So let's start with top down thoracic spine, cross your arms, touching opposite side shoulders, flexing down just a tad, twist as much as you can, extend back, twist, rotate around, and then back to center. Same thing, but opposite direction, okay? Now, focusing on lower back specifically. Crossing arms again, bending down as far as you possibly can forward. We're going to tilt, rotate around your pelvic rim, extend backwards. Make sure it's not into sharp pain. We'll come back down to center and same thing, opposite way. Extension, untilt around the pelvic rim and back to center, okay? Again, about 3 to 4 reps, both directions, each area. Now, hips. We can do hips a couple different ways. First, you want to start off, you're going to do it standing, either holding a support system if this is new for you. Bring, the more challenging it is, legs straight, easier, leg bent, or knee bent. We can bring I'll go start easier, our leg inwards, crossing our body. We're then going to start bringing the knee up to the chest as far as we can. We're then going to keep the foot inwards as we rotate our leg out to the side. And then once you get all the way over, you can start tilting and rotating as your leg is just to the side. Start extending backwards and then tap the ground. You can bend your knee, bring your leg in across your body, come back around opposite direction, untilt, and then come back to center, okay? Again, I'll go through the opposite leg, okay? Now, if you want to do this laying down, it usually works better laying on your side, okay? Again, the focus, leg across your body, bring it up to your chest, bring it up to your side, and then back down to the ground, okay? Both directions work really well, okay? Lay in both sides and then build up from there. Now, let's look at joint-specific effort for the knees. Joint-specific effort for the knees, you can do this seated, you can do this standing, focusing on legs straight, rotating the foot inwards, start to bend the knees as far as you possibly can. Rotate the foot outwards, straighten your leg as the foot is rotated out, okay? Same thing, keep the foot outwards, bend your knee till you can't anymore, foot inwards, straighten the knee. And you can go both directions, okay? Now let's focus on then the ankles. So if you want to zone in and making sure that we focus all the effort into the ankle joint specifically, whatever ankle you're focusing on, that opposite side arm goes underneath the thigh, hamstring. The other arm of the same side of ankle we're working holds the front shin bone. And then the arm, hand that is underneath the back of your leg, it holds to the forearm of that same side arm of the ankle you're moving, okay? If it's easier for you to understand, watch the video, we'll go from there. So as you go through the fullest range of motion, we want to keep your toes splayed upwards and then try to move down, point your toes up to the ceiling as you bring your ankle up, dorsiflex or ankle to your thigh, ankle to your shin. We're going to rotate out, big circle, point your toes down, roll your foot inwards, Splay your toes open up, start rotating opposite way. Again, both directions. Pointing toes down to the ground as your ankle goes down, toes off to the side, toes up to the ceiling as you move your ankle. Again, both directions, both ankles, fullest range of motion possible. Now, let's start off with joint range of motion with rotational work. So for us specifically, we're focusing on ball and socket joints, so hip works really well with this. So I suggest laying on your side. Essentially, it's going to be a hip workspace, moving through the biggest range of motion possible, but with rotations. Whatever leg you're going to focus on, that's the leg that's going to be up to the ceiling as you lay on your side. We're going to bring your leg all the way across your body the best you can. We're going to start by rotating, internal, external rotation, small micro movements as the leg is straight, working in the biggest range of motion possible. Front to back, rotational work, same thing. As you keep your leg straight, both directions, both legs. To make this more challenging, to build up not only the joint, but the tissues all the way around and surrounding the leg, put an ankle weight on. That will really challenge you, okay? Across your body, rotational work. The slower you go, the more challenging it is, focusing on legs straight. You'll probably notice when your leg goes off to the side, cramping, which is fine. You can take a break, go back into that same range of motion. Both directions, clockwise, counterclockwise. Suggest good 3 to 5 sets. You can break it into 2 sets if you want, or go into continuous movement until you can't anymore, until failure. That will build up the joint capsule, and like I said, all the tissues surrounding the thigh joint. All right, now let's get into laying down tissues of the hip capsule. We're going to start on the front quadrant of the thigh. So this is going to involve hip flexors, it's going to involve quads, core tissues, some of the tissues and muscles of the pelvic floor. So that might involve, in certain positions, squeezing your glutes or trying to tuck your tailbone into your body just to get a little different pulling mechanism, but there's some variability with that. So let's start off by addressing the tissues on the front of the quad thigh. So first off, just by keeping your legs straight in front of you, if you want to support backwards, cool. Just changes the angle on the hip. And trying to lift your leg up, either holding as long as you possibly can. You can add in some rotational effort, or if you want to go up and over objects as your toes are facing upwards, you can do that as well. Once you notice that your leg goes off to the side outwards, you might want to rotate your foot out, or else that could lead to some impingement symptoms or pain as you bring your thigh up to your body on the front portion of the hip, which that involves usually capsule joint effort, or the joint capsule of your hip has too much space and the capsule is not stiff and tight, which then I would go back to rotational work with the workspaces or cars. And again, we can work for continuous movement or effort in that same plane of motion, either rotational work up and down, holding it as high as you possibly can, legs straight. That will also help as well. Now let's add in a little bit of lengthening, not only from the back portion side of the joint capsule, so the back of your hip joint. You can do this a couple different ways. If you want to do this standing, laying down, lifting your leg up, straight leg raise, holding continuous effort. From there, if you want to bring your knee to your chest, bending your knee, squeezing your glute. So we're bringing the femur head backwards into the back portion of the capsule and it's lengthened. And then squeezing your glute. If you want to add in bending your knee up to your chest, but leg off to the side, that works really well. Add in some rotation of the foot as you bring your knee up to your chest. That will also help for different areas of the front of the hip capsule joint as well. Next, we can work into the back posterior side of the hip capsule. To address this, we did a little bit with bring your knee up to your chest, and we're lengthening the tissues on the back side. If you want to address some of the tissues on the front of the hip capsule, especially lengthening, this usually goes in the means of leg extension, or bring your leg backwards as you're either running, or just bring your leg backwards itself. So we first want to lengthen the tissues. So if you lay face down prone, finding books, or for this case, little blocks, putting in front of the knee, above the kneecap, so it doesn't bleed energy to your knee joint, which can be very uncomfortable. We want to also then, as your leg's in that position, center the pelvis. You can bend your knee ideally, and then try to put pressure of your knee down into the front of the blocks, books. We're contracting the muscles and tissues on the front of the hip joint. And then we're adding rotational work. You can add by bringing your hips outwards to get the outside portion of the joint capsule, out front side portion. Or you can do the same thing, but turn your hips inwards and trying to bring your knees down to the ground. So you can vary the degree and what tissues you're targeting based on how you move your pelvis, but you should keep consistent effort of your knee down to the ground as you rotate through. Again, not moving to sharp pain. If so, back off that specific plane and direction in which you move, and then go from there. That can go till failure, or for at least 2 minutes total a day to create tissue adaptation. But that will vary depending on the intensity in which you drive your knee forward into the ground, and or soreness, other symptoms from there as well. Let's go back to the posterior capsule of the hip joint, which involves the glute complex. It involves the hamstrings, and to a certain extent, some of the adductor tissues and the muscles on the inside portion of your thighs. Let's start off focusing on hamstrings, so working bottom up to the hip capsule. Now, most times people neglect bending their knee off to the side outwards or off to the side inwards. Bending off to the side outwards, or bringing and bending our knee with the foot going inwards. So when I like to work with patients is what's known as hammy up and overs. So we are sitting on a chair, we're bending the knee with the foot in and go up and around an object, or holding the knee bent and working, rotating our foot in and out as we're holding pressure and that contraction against gravity of our foot. You can add on ankle weights, which will help even more burn the hamstrings as well. You can add in rotational work with your foot going in and out while your leg bottom thigh is outwards, so going to hip internal rotation, or hip goes into external rotation, foot goes into closer to the body, and add in rotational work as well. All of which will help significantly for hamstring strength, and also bleeding that into the bottom portion of the hip capsule joint as well. Now, one awesome way to address the glute complex without going to hyperextension in the lower back is mainly this way. So you're gonna be facing downwards. One of the knees is gonna be bent, and your body's gonna be over that bent knee. From there, we wanna hold on to a bed, couch, table, and then extending the leg up backwards. It's gonna limit hyperextension of the lower back, but it's gonna bleed all the energy to the glute complex. Keeping the leg as straight as you possibly can, adding rotational work, but more or less trying to keep your leg up off the ground against gravity as long as you possibly can. If you wanna add on ankle weights to build up from there, even better. You can work your foot, leg inwards, outwards, which will also help for contraction of the glute max, which is one of the powerful tissues. But this usually works well for warm up to start going to squats, deadlifts, different type of explosive lower body movements as well. All right, now we're gonna work on the inside and outside portion tissues of the thigh. Some of this will include the glutes and the hip muscles, but this is an area for most people that gets neglected, especially if you incorporate balance work just the same As we start by addressing some of these tissues, we can start off with rotational effort in front of our body inwards and backwards. Again, with this, you're going to notice a little bit more stretch, so we're forcing lengthening eccentrically of the outside IT band, tensor fasciae latae, TFL tissue, into the glute complex as well. So, laying on your side, bring the foot in front of you, and then slowly having it bring down across the ground, holding the legs as straight as you can, forcing it down across your body, and then squeezing the muscles in the inside portion of your body. Keeping those tissues contracted, you can add in rotational work. As you bring your leg across your body up to your chest, and is straightened down closer to where your leg is straight or legs are side to side. Okay, now if we want to work behind us, in terms of adductor work, again, we want to extend the leg across our body, squeezing the muscles on the inside portion of the thigh as we go through, add in a little bit of rotational effort of the hip capsule. It's going to be hard to go into rotational work with your knee bent next to straightening your leg. Flexed, bent. So again, that's targeting the adductor tissues or the muscles in the inside front portion of the leg, the inside and the inside back portion of the leg. Hugely important. But next, let's go to the tissues on the outside portion of the leg. Okay, so with this, it's probably important to work up to the weight and get used to the movement. So what we're going to focus on is bringing the leg, stand on one foot, leg across our body, behind us, and in front of us, okay? Now this is usually for explosive type movements. It also can be involve rotational work as well. A little bit more coordination, but as you go through, you're going to start noticing your feet gripping the ground. I suggest for most people to go barefoot shoes or go no shoes at all, just barefoot. So as you bring your legs across your body, it's going to force the toes to stabilize the ground, which will work on the inside and outside arches of the feet. Okay, again, we can go for continuous effort for time, trying to keep our toes facing forward. You can extend backwards as well, but for this, the huge focus is going to be on the leg that we're stabilizing or the leg that's attaching to the ground. So that can work into what's known as a star pattern, okay? So balancing on one foot, bring our leg across our body, tapping down, coming back to center. You can add as many points as you want as you go across your body, which will then help for all the tissues across and around the hip joint. Both feet counterclockwise, same thing, okay? The further out you reach, keeping your balance, the better control, proprioception you have of tissues surrounding your hip joint and communication from your legs to your brain. So next, what we're going to work on, continue on the muscles in the inside-outside portion of the legs. It's what's known as adductor side planks. Now, if you find a spot on the ground, find a bench, chair, platform, laying on your side. If you need to have a mat below you, awesome. From there, coming up, holding a side plank, or if you want to come down and up with your leg behind you, that's closer to the ground, or in front of you. It's going to primarily help for the tissues on the inside portion of the leg. Leg out and in while holding pressure of your body against the platform. Leg up, hips drop to the ground. Or if you want to hold a weight on the inside portion of your leg, you can work on the one that's free floating. So we want the leg, the outside leg, to be on a surface, or we want the inside portion of the leg stabilized while holding weight and pressure with your leg going forward and backwards, which will help for all the tissues on the inside of the legs. Both directions, both feet, both legs, and then build up from there. So next we're gonna focus on the posterior chain. So this is gonna involve walking backwards. Now you can do this outside, you can do this in the gym on a treadmill. There's a bunch of different ways. Now the focus is gonna be on pushing off of the heel as the toes are facing straight forward. You can also work on some of the tissues more on the back outside portion by turning your feet or legs in one direction versus the other. You can work on bringing your toes outwards, your toes inwards. So there's different types of ways you can go about it. Ideally, working for longer periods of time helps significantly, especially lengthening your hamstrings. So as you push off your heel, you want to push off as the bottom of your foot leaves the ground, okay? It's going to help for all the tissues of the front and back side portion of the thigh. Now finally, the one at the end, specifically for the lower back, which will be a game changer for most people. With this, we're going to focus on effort of moving the bottom few segments of the lower back. Usually these are overused, especially when you have weight against gravity. So we want mobility to create tissue joint space to pump up and hydrate the discs in the lower back. And this is going to be a perfect way to go about it. Now, we're going to start off no weight. You then can add weight. I'll show you how to do that so you can build up the muscle structure around the lower back specifically. You can do this by going up to a bed, a couch. It's hard to do on a chair. And what we want to focus on is bringing the front hip bones to the edge of whatever surface you're going to lean on. You want to have something that you can hold your upper body so you isolate your lower back. Now it's a weird movement, it might look odd, but the focus is, again, movement, specifically of the lower back bones and segments to help create glide movement, to not fixate some of the joints, which oftentimes, for most people, get overused, lead to degeneration, and most people have symptoms that go down the legs, weakness, numbness, tingling, a bunch of other symptoms from there. So, hips, front hip bones to the side of the table, bed, feet hanging, dangling off to the ground. Now you're not going to push up with your feet. All the effort's going to be in your lower back. So we want to bring our hip backwards into extension, squeezing the lower back, and then we're going to lengthen the lower back down. Okay, so we squeeze the lower back like you extend your upper back backwards and back and forth, flexion, extension, flexion here. You can tilt with your hip going up to the right side, back down, tilt your hip going up to the left side, back down. Again, back and forth until you feel a good muscle burn, and we're not pushing off of the ground, so you can do this with your legs off the ground as well. It just gives you a good understanding with that there. Now, to build it from there, if you want to connect an exercise band and put it around your lower back, you can tie that band to weight and then have that dangle, and then it's going to be having the weight take you down forward and then putting pressure backwards, okay? So a lot of this will be pelvic tilts, but you're going to notice more of the effort in the lower back specifically. Again, not moving into sharp pain, but that gives you a good understanding of how to build up those tissues, specifically for the lower back when the joints are facing almost forward and backwards, which that's the main type of movement. The better you can build that up, the way better in terms of not only symptoms are, but in terms of stabilizing that lower back as well. Now with some of these upper and lower body type of workouts, again, use some of these specific exercises for where you need in your workouts. And again, if you're gonna spend some time addressing some of the tissues on the front of the hip, outside, inside portion of the hip, backside, or any of the muscles in the upper back, shoulders, neck, whatever tissues you're laying down, go back through after that effort through the workspaces or cars or greater increased range of motion, or the biggest range of motion you can possibly move in, so you can upload that information which you just did for whatever exercise that is. So what that means is add in the workspace, cars, circles in between heavy lifts or in between sets, and that'll drastically improve and accelerate not only the foundation, so you have less chance of becoming injured, but it'll also help lead to laying down tissues, which increase strength, mobility gains. Huge focus for most people.
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.